And welcome to Wellness Central, your go-to segment for all things health and wellness. Now, in today's edition, we're focusing on a condition that affects millions of women worldwide: uterine fibroids. Now, these non-cancerous growths in the uterus can cause a range of symptoms, from heavy menstrual bleeding to pelvic pain, and they can significantly impact a woman's quality of life.
Tell me about it. Now, despite being common, there are still many misconceptions about uterine fibroids, what causes them, how they can be treated, and when they become a serious concern. And so, to help us understand this condition better, we're joined by Dr. Modupe Adedeji. She's a highly respected consultant gynecologist who joins us live via video chat. Dr. Modupe Adedeji, thank you so much for being with us this morning.
Thank you very much.
Well, let's start with, thank you. Let's start with the basics.
Thank you for having me.
Thank you for coming on. Let's start with the basics, and I would like to know, what exactly are uterine fibroids and how common are they among women?
Yeah, thank you so much for having me. And I'm very happy that you decided to pick on this topic today. It's actually our disease because it's more or less from the African origin, and meaning that it's a black woman's disease, really. And we don't know why, but I think we should even actually thank God for that, because there are some other uterine conditions that are worse off that we may not be able to cope with in this part of the world. Because as you have it, they are benign growths. It's not cancerous, but a growth. It's just like the muscle of the uterus getting angry, and it starts to multiply. So there are three layers on the uterus. We have the endometrium, the muscle layer, and the covering that looks like some sort of a nylon that covers the uterus. We call it peritoneum. So on the part of the uterus, it's called serous. So, but the fibroid grows from the muscle layer. So it just starts multiplying, but never a cancer. And the way it grows that in a way that is easy to shell off when we need to remove it. So it's just a problem of the uterus, basically the uterus. You don't find fibroid elsewhere, but in the uterus. So it's not cancerous, but it's something to discuss because of the issues that it brings to the women in their reproductive life.
So, Dr. Adedeji, so you say it's not cancerous. Well, to some extent, we understand cancer, but fibroids, on the other hand, we have very limited understanding of exactly what causes them. So, question is, what exactly causes fibroids?
It's actually very annoying, because it's just like it's a reward of being a good woman. Most times we want to be the best before we start the journey of having our babies. So we want to achieve so many things, most especially as regards education. And then we tend to postpone our reproductive journey. What I mean is about getting pregnant and the likes. So we spend so much time in school, trying to be good enough for ourselves. But then the reproductive clock has started. As soon as we start menstruating, the first menstruation is called menarche. So as soon as it starts, it means that at any point in time, one can get pregnant. And that age of starting menses is around the age of 15, So 15, 16, 17, we are still waiting for you to get married. 19, 20, 25, obviously for the teenage age, it may be too early to do that, because even the pelvis is still getting ready to carry pregnancy. But obviously, getting to the 20s, late 20s, 30s and all that, you are good to go. And still, pregnancy is not coming in. So the point is just that you cannot have a vacuum. If you have a vacuum for a while, something will start happening inside it. And that's the simplest of way that I can just bring understanding to the people listening to me. One of the things that happens is that the fibroid just starts growing. And it's actually been explained by the fact that there is estrogen being produced, and they feed on estrogen. And the essence of estrogen, which is a feminine hormone, and progesterone, is to assist in ensuring pregnancy, bringing about ovulation, getting pregnant, and then the progesterone takes over to keep up the pregnancy until it is time to deliver. So when this keeps going on, circle in, circle out, and no pregnancy. So the fibroid the muscle of the uterus just key on that, and then they just feed on the estrogen, and then it starts to multiply. And that's where we start talking about fibroid. So most times you have fibroid occurring in later reproductive age. To mention, reproductive age is actually between 15 and 49 years. So by the time we are getting to mid-30s, late 30s, 40s, early 40s, then no pregnancy, or if at all, maybe one child or two, then you know that you're supposed to do more, and you are not doing more, but then something else will grow, and that's where we have fibroid.
And so I have to ask about, the risks. I have to ask about the symptoms then. This scares me because I'm a woman who is...
Yes, I can see your face.
You're fine. You're fine, Judith. It's okay.
I'm fine. Well, I mean, but I do have to ask what the symptoms are. If you're someone who's just tuning in, who happens to be in the same, in this bracket, and they seem to be at risk of this, what are some signs, symptoms they should be looking out for?
Yes, let me make us happy a bit, in that since the black woman's disease, so most times there is fibroid in the uterus and there is no symptom, most of the time. But the ones we pay attention to are the problematic ones. And what are the problems they bring to bear? Majorly the symptoms they come with, the feeling they give, and also the other problems that they can carry along. So I have grouped it into three. So let me start with the symptoms they bring with when they become problematic. And majorly it is excessive bleeding and pain. So we call the bleeding menorrhagia. Menorrhagia is when a woman is having excessive menstrual flow. Normally you use maybe 2-3 pads in a day, and then you just notice now that you are changing pads repeatedly. It's filling up. You are getting to buy more perineal pads, over the period of your menses. Or you are passing clots, that is solid blood, it's coming out, dropping out, and all that. And the bleeding can be so much that other symptoms can come in, like getting tired, getting weak, feeling headache, having palpitation. Palpitation is feeling that your heart is beating. On a normal day, we shouldn't know that our heart is beating, and all that. And the most worrisome of that is even fainting episodes. So that means that the patient is bleeding a lot, So that's one symptom that you cannot hold back, because most times people hold back all of these symptoms and don't present to the hospital on time. But by the time it's getting to this point of, if people are wondering why you are white, clearly white, just because they've been bleeding, then they present. Another thing is terrible menstrual pain, which we call dysmenorrhea. The pain is crazy, in that it may even prevent you from going to work. Everybody just knows that you're on your menses because probably you take off from work at this period, because of the terrible pain. It could even warrant admission in the hospital. After you have tried so many pain-relieving drugs, and then it may not be working and all of that. So those are the common complaints. Then another thing is about the size. Most times there may be none of bleeding, none of pain, or they all come together, but the size of the fibroid. And then people are wondering if you are pregnant or you are not pregnant. And then if it's happening to someone who has even never been pregnant before, everybody will be expecting a delivery someday. And they'll be counting, the people, our village members, that may be counting months for you, non-delivered. So the thing is big, you're embarrassed, you find yourself wearing bigger clothes, trying to cover up. And beyond that, it can even come with its own symptoms, called pressure symptoms. There are other organs that surround the uterus, which can be affected. We have the bladder, we have the intestine, we even have the diaphragm, that's the cover of the lungs. So when the fibroid is so big, it can cause irritation on the bladder that you notice that you are frequently urinating. And if it's that big too, it could cause an obstruction and you find out that you cannot pass urine. That's urinary retention. Then another thing is that it can press on the intestine and you find out that you are usually constipated, your fecal matter hard. You find it difficult to get it out in the toilets, excuse my word for that, and then you even find out that you find yourself eating just a little, even though you want to eat more. That's what we call easy satiety, meaning that you are easily satisfied. Then coming to the lungs, you find out that you can't take a distance, you start panting, or you cannot even climb up the stairs. You cannot breathe well and all that. These are the times that our own type of patients come to the hospital. And I'm emphasizing that.
Doctor,
and all of that. Then those are the basic group of problems that patient comes with symptoms.
All right, doctor.
The list of it is actually
Doctor, I'm so sorry.
let me just speak.
Yeah, if you can round up on that real quick, I'll let you.
Yeah, the last of it is the fact that people get aware of it when they are being investigated for infertility. You know, there may not be anything wrong at all, but by the fact that there are fibroids and we find out those fibroids may be an issue, then we want to remove it and so that it can improve fertility. Thank you. I'm sorry.
No, it's fine. I mean, and then we have to talk about treatment then. We have seen situations where, because we're out of time, so we're pressed for time, and I need you to answer this, because a woman might be watching and see that she has the symptoms, and they might decide to go for alternative method, which is traditional, the traditional herbs. What is your take on this, and what is the best alternative or best treatment for dealing with fibro? Very quickly, we're out of time.
So I can see that you're in a hurry. So I like the angle that you're taking it from. Taking herbals, and the reason I've been emphasizing on late presentation, taking alternative treatments, all because of the fear of surgery. You understand? All of these things make the surgery quite extensive. Most times, when you come in early, we'll pick you up and then we can give you follow-up. We can manage the symptoms only, and we only do surgery when it is necessary. You understand? So there are reasons why we do surgery. Reasons for surgery is when the symptoms are so bad and our medical management are not working. Medical management to stop the pain, to stop the bleeding. Then we have no option but to do a surgery for you, either myomectomy or hysterectomy. Myomectomy is done for women who are still wanting to get pregnant, while hysterectomy is done for women who have completed their family size. You know, another thing is that these surgeries are carefully done and well selected because it should not have a bearing on your getting pregnant in future. So basically the treatment line is we'll review you and then we'll know what will work for you at the time. Medical management or surgical management.
Dr.
And as I said
Adedeji,
earlier, when it's coincidentally picked up, you may not even need a surgery until probably we think that there's an indication for it.
Obviously, Doctor, there's so much that we can't contain inside of this little segment here, but we're very sure that we'll be bringing you back to give us more insight on that one because it's very important for many women across Nigeria to actually know about this and the world, of course. Thank you very much, Dr. Adedeji.